Hey everyone, and welcome. Let's master the F drugs. Here's the 25 most common medications tested. How many do you recognize? Fentanyl is used to treat severe pain. Furosemide is used to treat fluid retention, edema, and high blood pressure. Fluconazole is used to treat fungal infections. Fluoxetine is used to treat depression, obsessive compulsive disorder, and panic disorder. Fluticasone is used to treat asthma, allergic rhinitis, and certain skin conditions. Folic acid is used to treat and prevent folate deficiency and certain types of anemia. Famotidine is used to treat ulcers, gastroesophageal reflux disease, which is GERD, and heartburn. Fenofibrate is used to lower high cholesterol and triglyceride levels. Finasteride is used to treat benign prostatic hyperplasia, BPH, and male pattern hair loss. Felodipine is used to treat high blood pressure and angina. Fluvoxamine is used to treat obsessive-compulsive disorder and social anxiety disorder. Phosphomycin is used to treat urinary tract infections. Fosaprepitant is used to prevent nausea and vomiting associated with chemotherapy. Fostamatinib is used to treat chronic immune thrombocytopenia. Fesoterodine is used to treat overactive bladder. Fidaxomicin is used to treat Clostridium difficile-associated diarrhea. Filgrastim is used to prevent infection in patients undergoing chemotherapy by increasing white blood cell production. Flibanserin is used to treat hypoactive sexual desire disorder in premenopausal women. Floxuridine is used in chemotherapy to treat certain cancers, especially those of the gastrointestinal tract. Fluocinanide is used to treat various skin conditions like eczema and psoriasis. Fluorouracil is used in chemotherapy to treat various cancers, including breast and colorectal cancer. Flufenazine is used to treat schizophrenia and other psychotic disorders. Flurbiprofen is used to relieve pain and inflammation from conditions like arthritis. Flutamide is used to treat prostate cancer. Provatriptan is used to treat acute migraine attacks. Let's keep going. Here are the adverse reactions of the F drugs that exams love to test. Fentanyl is used to treat severe pain. Adverse reactions: respiratory depression, sedation, confusion, drowsiness, dizziness, nausea, vomiting, constipation, urinary retention, pupillary constriction. Furosemide is used to treat fluid retention, edema, and high blood pressure. Adverse reactions: dizziness, lightheadedness, headache, blurred vision, muscle cramps, dehydration, electrolyte imbalances, for example, low potassium, increased urination. Fluconazole is used to treat fungal infections. Adverse reactions: nausea, abdominal pain, diarrhea, headache, rash, elevated liver enzymes. Fluoxetine is used to treat depression, obsessive-compulsive disorder, and panic disorder. Adverse reactions: nausea, insomnia, drowsiness, headache, anxiety, nervousness, sexual dysfunction, for example, decreased libido, erectile dysfunction, anorgasmia, tremor, dry mouth, sweating. Fluticasone is used to treat asthma, allergic rhinitis, and certain skin conditions. Adverse reactions: inhaled nasal, headache, throat irritation, cough, nasal irritation, bleeding, hoarseness, oral candidiasis, thrush. Topical: skin irritation, burning, itching, dryness, thinning of the skin. Folic acid is used to treat and prevent folate deficiency in certain types of anemia. Adverse reactions: generally well tolerated. Rare reactions may include allergic reactions, rash, itching, nausea, abdominal distension, gas. Famotidine is used to treat ulcers, gastroesophageal reflux disease, GERD, and heartburn. Adverse reactions: headache, dizziness, constipation, diarrhea, nausea. Less common but more serious reactions can include confusion, hallucinations, or heart rhythm changes, especially in older adults or those with kidney disease. Fenofibrate is used to lower high cholesterol and triglyceride levels. Adverse reactions: abdominal pain, nausea, constipation, diarrhea, headache, back pain, muscle pain, elevated liver enzymes, increased risk of gallstones. Finasteride is used to treat benign prostatic hyperplasia, BPH, and male pattern hair loss. Adverse reactions: decreased libido, erectile dysfunction, ejaculation disorders, breast tenderness or enlargement, depression, suicidal thoughts. Rare. Felidipine is used to treat high blood pressure and angina. Adverse reactions: peripheral edema, swelling of ankles, feet, headache, flushing, dizziness, palpitations, gingival hyperplasia, gum enlargement. Fluvoxamine is used to treat obsessive-compulsive disorder and social anxiety disorder. Adverse reactions: nausea, insomnia, drowsiness, dry mouth, sweating, nervousness, sexual dysfunction, headache, dizziness, asthenia, weakness. Phosphomycin is used to treat urinary tract infections. Adverse reactions: diarrhea, nausea, headache, dizziness, abdominal pain. Fosaprepitant is used to prevent nausea and vomiting associated with chemotherapy. Adverse reactions: fatigue, headache, hiccups, dizziness, constipation, dyspepsia, neutropenia. Fostamatinib is used to treat chronic immune thrombocytopenia. Adverse reactions: hypertension, diarrhea, nausea, elevated liver enzymes, dizziness, rash. Fesoterodine is used to treat overactive bladder. Adverse reactions: dry mouth, constipation, dry eyes, headache, dizziness, blurred vision, urinary retention. Rare but serious: angioedema. Phodaxomatin is used to treat clostridioids, difficile-associated diarrhea. Adverse reactions: nausea, vomiting, abdominal pain, gastrointestinal hemorrhage, anemia, hypersensitivity reactions, for example, rash, angioedema. Filgrastim is used to prevent infection in patients undergoing chemotherapy by increasing white blood cell production. Adverse reactions: bone pain, muscle pain, headache, fatigue, fever, rash, splenic enlargement, rare but serious. Flibanserin is used to treat hypoactive sexual desire disorder in premenopausal women. Adverse reactions: dizziness, somnolence, drowsiness, nausea, fatigue, insomnia, dry mouth, hypotension, low blood pressure, syncope, fainting. Floxuridine is used in chemotherapy to treat certain cancers, especially those of the gastrointestinal tract. Adverse reactions: nausea, vomiting, diarrhea, stomatitis, mouth sores, alopecia, hair loss, bone marrow suppression, leading to anemia, leukopenia, thrombocytopenia, skin reactions. Fluocinonide is used to treat various skin conditions like eczema and psoriasis. Adverse reactions: burning, itching, irritation, dryness, folliculitis, inflammation of hair follicles, acne, skin atrophy, thinning, striae, stretch marks. Fluorouracil is used in chemotherapy to treat various cancers, including breast and colorectal cancer. Adverse reactions: nausea, vomiting, diarrhea, stomatitis, hair loss, bone marrow suppression, hand-foot syndrome, redness, swelling, pain on palms and soles. Photosensitivity. Flufenazine is used to treat schizophrenia and other psychotic disorders. Adverse reactions: extrapyramidal symptoms, for example, tremors, rigidity, involuntary movements like tardive dyskinesia, sedation, dry mouth, blurred vision, constipation, orthostatic hypotension. Flurbiprophene is used to relieve pain and inflammation from conditions like arthritis. Adverse reactions: nausea, dyspepsia, indigestion, abdominal pain, diarrhea, headache, dizziness, edema, increased risk of gastrointestinal bleeding or ulceration, cardiovascular thrombotic events. Flutamide is used to treat prostate cancer. Adverse reactions: hot flashes, diarrhea, nausea, vomiting, gynecomastia, breast enlargement in men, liver toxicity, rare but serious. Frovatriptan is used to treat acute migraine attacks. Adverse reactions: dizziness, fatigue, headache, nausea, dry mouth, paresthesia, tingling, chest discomfort. Let's finish strong by doing the contraindications or black box warnings of the F drugs. Fentanyl. Contraindications: significant respiratory depression, acute or severe bronchial asthma in an unmonitored setting, or in the absence of resuscitative equipment, known or suspected paralytic ileus. Black box warning. Risk of addiction, abuse, and misuse, potentially leading to overdose and death. Risk of serious or fatal respiratory depression. Accidental ingestion or exposure, particularly in children, can result in a fatal overdose. Concomitant use with benzodiazepines or other CNS depressants may lead to profound sedation, respiratory depression, coma, and death. Furosemide contraindications. Anuria, absence of urine production. Hypersensitivity to furosemide or sulfonamides. Black box warning. A potent diuretic that in excessive amounts can lead to profound diuresis with water and electrolyte depletion. Careful medical supervision is required, and dosing must be adjusted to the individual patient's needs. Fluconazole contraindications. Concomitant administration with terfenadine, astemazole, cisapride, or pimozide due to risk of serious cardiac arrhythmias. Hypersensitivity to fluconazole or other azole antifungals. Black box warning, none. Fluoxetine contraindications. Concomitant use with monoamine oxidase inhibitors, MAOIs, or within 14 days of discontinuing an MAOI. Concomitant use with thioridazine due to risk of QT prolongation and sudden death. Concomitant use with pimozide. Black box warning, increased risk of suicidal thoughts and behavior in children, adolescents, and young adults, up to age 24, with major depressive disorder and other psychiatric disorders. Fluticasone, contraindications. Primary treatment of status asthmaticus or other acute episodes of asthma where intensive measures are required. Hypersensitivity to fluticasone. For nasal sprays, recent nasal trauma, surgery, or ulcers until healed. For topical use, rosacea or perioral dermatitis. Black box warning, none. Folic acid contraindications. Untreated pernicious anemia or other megaloblastic anemias where vitamin B12 deficiency is present, as folic acid can mask B12 deficiency and allow neurological damage to progress. Black box warning, none. Famotidine contraindications. Hypersensitivity to famotidine or other H2 receptor antagonists. Black box warning, none. Fenofibrate contraindications. Severe renal dysfunction, including dialysis patients. Active liver disease, including primary biliary cirrhosis and unexplained persistent liver function abnormalities. Pre-existing gallbladder disease. Nursing mothers, known hypersensitivity to fenofibrate. Black box warning, none. Finasteride contraindications. Pregnancy, category X. Women who are or may become pregnant due to potential for male fetal abnormalities. Hypersensitivity to finasteride. Black box warning, none. Felidipine contraindications. Hypersensitivity to felidipine or other dihydropyridine calcium channel blockers. Black box warning, none. Fluvoxamine contraindications. Concomitant use with MAOIs or within 14 days of discontinuing. Concomitant use with thioridazine, pimozide, stishambayu, or tizanidine. Black box warning, increased risk of suicidal thoughts and behavior in children, adolescents, and young adults, up to age 24, with major depressive disorder and other psychiatric disorders. Phosphomycin, contraindications. Hypersensitivity to phosphomycin. Black box warning, none. Fosaprepitant contraindications. Concomitant use with pimozide or terfenadine due to potential for serious and/or life-threatening reactions. Hypersensitivity to fosaprepitant or aprepitant. Black box warning, none. Fostamatinib. Contraindications. None listed as absolute contraindications. Black box warning, none. Fesoterodine contraindications. Urinary retention, gastric retention, uncontrolled narrow-angle glaucoma, hypersensitivity to fesoterodine or tolterodine. Black box warning, none. Fedexomicin contraindications. Known hypersensitivity to fedexomicin or any other ingredient in the formulation. Black box warning, none. Filgrastim contraindications. History of serious allergic reactions to human granulocyte colony stimulating factors, GCSFs, such as filgrastim or pegfilgrastim products. Black box warning, none. Flubanserin contraindications, concomitant use with alcohol, moderate or strong, CYP3A4 inhibitors, due to increased risk of severe hypotension and syncope, or in patients with hepatic impairment. Black box warning, risk of severe hypotension and syncope, especially when used with alcohol, or moderate strong CYP3A4 inhibitors, or in patients with hepatic impairment. Floxuridine contraindications, patients in a poor nutritional state, those with depressed bone marrow function, or those with potentially serious infections. Pregnancy. Black box warning. Due to the possibility of severe toxic reactions, all patients should be hospitalized for the first course of therapy. Severe hematological toxicity, gastrointestinal hemorrhage, and even death may result despite careful patient selection and dosage adjustment. Fluocinolone contraindications, hypersensitivity to fluocinolone or other corticosteroids, viral infections, for example, herpes simplex, varicella, at the treatment site, fungal infections at the treatment site. Black box warning, none. Fluorouracil contraindications, severely debilitated patients, patients with bone marrow suppression due to radiotherapy or chemotherapy, pregnant or breastfeeding women. Black box warning, increased risk of serious or fatal adverse reactions in patients with low or absent dihydropyrimidine dehydrogenase (DPD) activity. Withhold or permanently discontinue fluorouracil in patients with evidence of DPD deficiency. Fluphenazine contraindications, comatose or severely depressed states, presence of blood dyscrasias, liver damage, subcortical brain damage, severe central nervous system depression. Hypersensitivity to phenothiazines. Black box warning, increased risk of death in elderly patients with psychosis related to dementia. Flurbiprofen. Contraindications, history of asthma, urticaria, or other allergic-type reactions after taking aspirin or other NSAIDs. Not for perioperative pain in the setting of coronary artery bypass graft, CABG, surgery. Black box warning, nonsteroidal anti-inflammatory drugs and NSAIDs increase the risk of serious cardiovascular thrombotic events, myocardial infarction, and stroke, which can be fatal. This risk may increase with duration of use. NSAIDs cause an increased risk of serious gastrointestinal adverse events, including bleeding, ulceration, and perforation of the stomach or intestines, which can be fatal. Flutamide contraindications, hypersensitivity to flutamide and or any component of the formulation. Women, especially pregnant women, due to potential harm to a male fetus. Black box warning, may cause liver damage that can be serious or life-threatening. Fatal hepatic injury has been reported. Liver function tests should be monitored periodically. Frovatriptan contraindications, ischemic heart disease, for example, angina pectoris, history of myocardial infarction, symptomatic arterial disease, for example, peripheral vascular disease, ischemic bowel disease, uncontrolled hypertension, severe hepatic impairment, basilar or hemiplegic migraine, previous cerebrovascular event or transient ischemic attack, concomitant use with ergotamine-containing or ergot-type drugs, or other 5-HT1 agonists. Black box warning, none.